For the frontonasal osteosynthesis, a mini plaque of titanium of a specific design is selected and must be conformed and adapted according to the anatomic region and the desired type of fixation. Once the plaque is adapted and kept in position, a first hole is opened with the appropriate drill, taking into consideration the diameter and length of the chosen screws. The stabilization of the plaque is attained with the placement and adjusting of the first screw, allowing to drill the other holes and to place the rest of the screws much easier. After the frontonasal osteosynthesis is completed, the plaque is screwed. A relative stability is achieved in the hole, allowing to insert the following grafts and plaques with greater control and security. For the planned Lefort 1 osteotomy, cuts are made on both sides of the upper jaw. A manual mobilization of the maxillary block is executed downward and laterally until achieving the total independence of the structure. Along the incision in the vestibular groove, the bone plane is exposed. After carrying out the osteotomy and the maneuver described before, the jaw is able to be advanced 12 additional millimeters beyond the 8 millimeters achieved through the Lefort 3 osteotomy, thus completing the 20 millimeters the upper incisives should advance to normalize the dental occlusion. This advance is also guaranteed with the placement of mini plaques at the buttresses of the maxillar. 2 plaques at each side screw to the malar buttress and to the reinforcement of the piriform opening provide great stability to the mobilized bone block. Now we can observe on After the closure of the coronal incision and the application of a copeline bandaging, the operation is concluded. The change already observed in the profile of the patient is very significant. In the evaluation of the changes occurring in the existed before the operation, the nose-lips-chin relation, as well as the great dimensional changes in her face. The distant memory, which has been replaced by a normal and even pleasant facial image.